Good morning, ladies and gentlemen. Today I would like to present you my presentation titled Risk Factor Analysis of Patients with Cardiogenic Shock in Acute ST Segment Elevation Myocardial Infarction Treated with Primary Angioplasty. Our department treats 250 and between 250 and 300 patients with ST segment elevation myocardial infarction STEMI every year. We analyzed a group of 270 patients with STEMI treated with primary coronary angioplasty between April 1st, 2018 and March 31st, 2019 in our cardio center. The aim of this work was to analyze a subgroup of cardiogenic shock patients, survivors and deceased, with acute STEMI treated at our department with PCI and evaluate the difference between shock and non-shock patients with STEMI and the influence of factors on mortality in a subgroup of cardiogenic shock patients. We have 270 patients with acute STEMI. We divided them into two big groups. First group, cardiogenic shock patients, 49 patients, and patients who were free of shock at admission, 221. In each of group, there were survivors and deceased. Here we have table with patient characteristic. In first column, we have a value of all groups. It means together cardiogenic shock and no-shock patients. And in second one, we have characteristic only of shock patients. Now I am going to talk only about cardiogenic shock patients. We can see that mean age was around 68 years. There were 31 men and 18 women. Culprit lesion, left main was culprit lesion in 4 cases, ramus interventricularis anterior in 19 cases, ramus circumflex 4 patients, arteria coronaria dextra 22. No one has bypass or left intermediate as culprit lesion. 88% of them achieved post-PCI TIMI-3, which means complete perfusion. Median of ischemic time was 163 minutes. 78% of them achieved complete revascularization. 1/3 was indicated to recoronarography. Every one of them was in cardiogenic shock at admission. 16 of them had ventricular fibrillation at admission, and then we can see echocardiographic parameters. Mean ejection fraction of left ventricle was around 40%, and other echocardiographic parameters. In personal history, 74% had hypertension, 1/3 had diabetes mellitus, 9 of them had known ischemic heart disease, 4 of them had stroke, 40%, 18 were current smokers, and more than half of them had a family history with cardiovascular event. Median of creatine kinase was 15. Median of troponin was more than 3,000. Median of NT-proBNP was more than 1,800. Median of C-reactive protein was more than 100. Glomerular filtration rate mean was around 65. LDL cholesterol mean was around 3 millimole per liter, and more than half of them had hyperuricemia. Comparison of shock and non-shock patient with STEMI. Here we have again table with same parameters, and we compared cardiogenic shock patients with patients who were free of shock at admission. And we can see that statistically significant at the level 0.05 came out the following parameters. NT-proBNP, then glomerular filtration rate, C-reactive protein, hyperuricemia, It continues. Post-PCI TIMI-3, post-PCI TIMI flow defect versus 3, ischemic time, ventricular fibrillation at admission, and left ventricle ejection fraction. In the last part of my presentation, I am going to talk about selective parameters and influence on survival in shock patients. We used univariate Cox regression models. And again, table with same parameters, and we can see that statistically significant at the level 0.05, which means these parameters are associated with survival, came out age per each 10 years. Then stroke in personal history, glomerular filtration rate per 1 milliliter per minute, post-PCI TIMI flow defect versus 3, recoronarography, and left ventricular ejection fraction. We can see that LDL cholesterol came out with borderline significance, but not significant at the level 0.05. And we can also see that ischemic time is not associated with survival because it's not that independent risk factor, but depends on a patient's condition. At the end, we can say that statistically significant differences between shock and non-shock patients were in the following parameters: left ventricle ejection fraction, natriuretic peptides, glomerular filtration rate, hyperuricemia, CRP, post-PCI TIMI-3, post-PCI TIMI flow defect versus 3, ischemic time, and ventricular fibrillation at admission. Influence on survival in cardiogenic shock patients. All these parameters are associated with survival. And as I said, LDL cholesterol came out with borderline significance, but not significant at the level 0.05, and ischemic time is not associated with survival because it's not an independent factor, but depends on patient's condition. The shock patients were at admission in more serious clinical condition. That's why they had shorter ischemic time.
Thank you so much, Zuzana, also to be in time. So that's allow us to have 3 minutes discussion. I just would like to start asking, you mentioned troponin. Is that high-sensitive troponin?
Yes,
Okay.
high-sensitive troponin.
Because I was surprised it was not really so much elevated. Please.
Hello, I want to ask you what exactly was the ischemic time in your presentation or in this sample of patients?
Ischemic time in minutes was time since symptom starts, chest pain, until a balloon insufflation in cath lab.
Any other question? Dr. Mazip?
Thank you for the presentation. You have a quite high proportion of patients with cardiogenic shock, nearly 20%. Did you analyze how many of them were in shock on admission or developed shock during the stay?
Every one of them was in shock admission, and we defined shock. They need catecholamine support, and because they had a systolic blood pressure lower than 90.
Probably you have a reference center that you receive more severe patients than
Yes. Mm-hmm.
Okay. Just another comment is that it seems that kidney makes a difference in your patients, right? Mm-hmm. That means that these patients had already some kidney involvement before STEMI, or was some ongoing damage of the kidney. What do you think?
Some of them already had chronic renal insufficiency, but some of them
Developed during the procedure.
exactly,
right?
it get worse because of all condition.
Okay, thank you so much.
Thank you.